glad you guys are here. I'm Andromeda. I'm a chiropractor, and I am a Schroth therapist, which is a scoliosis therapist. So I do the exercises and all of the therapy type things. I don't do any of the bracing. So that's kind of where I come from. I had scoliosis as a little girl, and they just didn't have anything to offer me, literally nothing. So I survived by going to the chiropractor, getting massage, and just doing that until I was in my 40s. And then we had, I have a Pilates studio in the Valley, and we had a woman who was probably in her early 60s degree curve, and the doctor said, that's it, we have to do surgery. And she didn't want to do that. And she was already in her 60s age-wise and wanted to know, what can I do? And I was like, I don't really know. I mean, I went to chiropractic school. I can tell you, like, to get adjusted, but what else is there? I don't know. Let me do a little Googling. Yeah. And I found this place that did this like boot camp style program. And I said, this looks interesting. You could try this. But it was like thousands of dollars, and it was a whole weekend of all day, every day, kind of boot camp style thing. And they put her in this really bad brace. And but she came back with this really cool pamphlet that wasn't customized to her. It was kind of like a generic thing. It was very general. But I was like, what is this? I had never seen anything like it. I was completely, yes. It was like these Schroth exercises, these scoliosis exercises. So I started looking into it. She was a German physiotherapist type person.
Okay.
Many years ago. She's long gone. And she invented this program for herself. She had scoliosis, and they put her in, I can't even imagine what kind of brace back in 80 years ago, like a steel brace. And she said, no, there's got to be something better that I can do. So she kind of came up with these techniques for herself, which is exercises that are very asymmetrical, breathing techniques, which are asymmetrical, hanging we were talking about earlier. Yeah. So the whole method is based on her invention, and then it's been customized and modified, and it's evolved like crazy over the years. So
they started me out on the metal brace, and I couldn't believe how much before I found Dr. Richey.
I mean, look how far we've come with the technology. It's incredible.
Yeah.
Now we have 3D scanning and 3D printing, and
you have all of that too.
All the technology and the research they've done. They were doing hardly any research, but
no.
Anyway, so that's kind of where I come from, and that's what Schroth is in an absolute nutshell.
Okay.
So, yeah.
So you do the Schroth at your clinic
Yes.
in Encino?
Yes.
Okay.
So I do that 95% of the time. I do also run the Pilates studio, and there were some Pilates questions. We didn't get to really get into that. Scoli balance. Yes. Okay. So in this Schroth technique, which, as I was saying, is very old. It's been around a long time, and she's long since died. She passed it along to her daughter. The daughter passed it along to her son. He's still alive. So I learned from him, and it was very like original Schroth. But then that method has splintered into all these different techniques because everybody's got their different countries, 100%, and their different philosophies of how they want to impart this information. And research is just going bananas. So Scoli Balance is a version of the Schroth exercise with their own protocols designed to go with the brace. Nice. So I did the Scoli Balance program. There are 2 levels of it, and it's Australian. Did you guys know that?
No.
Mm-hmm. The Scoli Balance and the Scoli Brace is...
What does it do more than the brace and more than the Schroth? What is it?
It's like postural re-education, like how should you hold yourself? How can you activate your muscles, whether you're in your brace or not? Where should you breathe away from the curves? And you said balance, and I was like, balance?
I know.
But there is some balance, too. There are some, like, balancing exercises. Yes, ma'am?
I'm sorry, you can breathe away from your curve?
Yes.
Can I see an example?
Yes. So actually, if you notice, so in the brace, you will notice, and we're just gone off on all tangents, and I love it. You notice that there are holes in the brace, right? And most braces that are 3-dimensional like this will have holes in the brace, or they'll have an area that's bubbled out. That's called a blowout. And that means that there's space there for you to like migrate away from your curve. So if the brace, like your brace here, is pushing on you on the right, correct? And then you want to have a space here on the left so that you're not just pushing your curve into a wall, because that wouldn't do much. Like the old braces used to just kind of squish you everywhere, and they were very symmetrical, thinking they would just hold the curve and it would do whatever. I don't know what it was supposed to do with that information. Thank you.
Yeah, I did nothing.
Right? Except maybe make you atrophy, because if you think about anything that you would just squeeze on you perpetually, your muscles would not do much anymore. They would give up, right? Yes.
So is the idea to wear the brace long enough to where your muscles will grow back and to support the way your spine is supposed to be or was originally, and now it's gone all haywire?
The muscles don't always get the memo. You're moving your
That's
spine,
the
you're moving
problem.
your
That's why I am
skeleton.
screwed up because with me, I cracked a vertebrae like 5 years ago, and I never went back for a touch-up, a look up to the doctor because I thought I had been leaning inadvertently for like 5 years, and then all of a sudden I have a great. So
the leaning
so the muscles,
causes,
it's not like my arm bent another way. It's
Right.
the muscles, right?
the muscles
Or
can
directing it wrong.
direct it or not direct it. Like they can cause an area of weakness where, like you said, with leaning, like if there's a weak zone, your spine can collapse into weakness. So the brace is a scaffold, right? It will push the curve, it will hold you up, it will give you stability, it
And
will
the
do all the
muscles
things.
will maybe grow back
The
to
muscles
support
don't necessarily know what to do. You have to still send the information.
it. You sure know what to do when you're leaning.
You have to
over.
tell them, right?
Do you fall down a lot?
Well, do I let it?
Fall down?
No.
Oh, I do.
Well, they sure knew which way to stick when I was leaning the wrong way. Now they just grew it. It's just like, I feel like they're so.
Well, the
strong
breathing
the wrong
techniques
way.
would go along with that, but then the postural reeducation and just like learning how to hold yourself better,
Yeah,
because your
by
muscles have to kick in and do part of the job. But to go back to the holes in the brace, like the blowout areas, that's intended so that your muscles will still work in those spots, that you don't have that atrophy, but also so that you can breathe and expand, who knew, away from the pressure of the curve of the brace. So if your brace is pushing you on your right curve and there's an empty space here, you could just have your brace on and just practice breathing into those holes. And by breathing into those areas, you are waking up those muscles because they're like,
Yeah, exactly.
they're asleep and they're not going to do anything until you tell them to do something.
I see.
Weirdest thing
Wake
is
up.
That's what I unconsciously or subconsciously, that's what I do.
Okay,
No
beautiful.
way.
But I didn't know if it was okay.
Absolutely. And,
Okay.
you know,
Look how
that's
better
why
you
they're
get,
there.
too.
That's why they're there to encourage you to do that.
That's the coolest
But there should be a little note inside that says, hey, breathe into me to remind you.
Awesome, your body just knew.
But yeah, breathing away from the curves is a really big deal.
So 70 is kind of getting back to a normal spine.
70?
Yeah. Right?
70 what?
Years old.
No.
Oh, this curvature.
It's like the curvature you can get from, like, I think I was only like a 19 or something when I started coming on here because I was really bent over.
Oh, you mean forward curve.
Well, I have both.
Forward bending. Okay, okay.
I have the C and the S.
Okay.
So he's dealing with that.
Okay.
But, the last x-rays, we've taken 2 sets of x-rays, but the last x-rays, phenomenal.
Yeah.
I mean,
You want to
he's
see
like-
that kind of correction in the brace, right?
Yeah, because
Yeah.
it does. It makes me really want to keep going.
Yeah, it
and that's
inspires you
why-
to, hey, we're
Yeah.
having progress here, let's keep going.
Right.
That's the difference
Yeah.
between a good brace and a bad brace, because there are some bad braces that
Oh,
aren't
there's
doing
some bad
much.
I've never been to a chiropractor before.
Yeah.
So, this is all very
whole
new
new
to me
thing.
in the last,
Well, let's get into this lecture-y thing, and if
Okay.
it inspires more questions, let's do it. I'm all about it. Like, I don't have to be on an agenda at all, but some of this you might find like, who knew? So if we think about your whole body as just a whole bunch of blocks, like these goofy yoga blocks or like a set of Jenga blocks, you know that if you want to pull the Jenga block out of the bottom pile first, that's going to make it really difficult for your opponents, right? But in Scoli, we have basically 4 blocks that you want to kind of think about. and they love to do opposite things of each other. We don't realize that your pelvic block likes to do things. And you might notice that your brace is either pushing your pelvis or holding your pelvis a certain way, because the pelvis with different curve types, and there are all these different curve types, right? Everybody is like completely unique, that the pelvis can be shifted off to the side. And then the lumbar block, its own block, can shift the other way or the same way. And then your thoracic block. So if the pelvis wants to go off to the side, and then the lumbar wants to go off that way, and then the thoracic block is going to go somewhere opposite, the shoulders are probably also going to go somewhere opposite. So they will zigzag on each other, but they also will rotate on each other. So the pelvis may or may not rotate, but most of us in the room, tell me if I'm wrong, have a left lumbar curve and a right thoracic curve, but they can go the other way. So if a lumbar curve shifts and curves to the left, it's going to rotate backwards on the left. And then we come to the thoracic block, which usually goes to the right, but not always, and that's going to rotate backwards on the right. Then the shoulders are always going to go opposite of that now, so now the shoulders will rotate forward.
Wait, so it typically always rotates?
Yes,
Why is that? That's interesting.
because it's like a three-dimensional object. Whenever there's asymmetrical pressure on something, it will cause it to spiral.
I'm just wondering why it wouldn't go, like why it's one direction versus the other.
Just because of the way that it's complicated, the way that you put pressure on the vertebral column, when it starts to slide sideways, it will start to rotate a certain direction. There is a possibility it could rotate the
Most of us
very.
have the rib hump on the left.
So most of, I mean, and then percentage-wise, we're going to say that 80% of scoliosis, that's the type that we most have, which is idiopathic, is in females.
Yes.
And then 80% of those people, those female people, have the thoracic curve that goes to the right.
Is it because they're right-handed?
They don't know why. They don't know why. There's a theory that the heartbeat
Oh my God.
might be like encouraging it, or that we're right-handed dominant, and it's a right-handed world and they tend to lean to the right, but there's nobody really knows for sure. It's not that we haven't seen lefties. I see them a lot, but it's supposed to be a red flag that if a curve goes to the left, that you want to go, maybe there's a neurological reason why it would be atypical. They're not as atypical as they make it sound. I see a lot of lefties, but most of us, probably in the room, myself included, the thoracic goes to the right. It doesn't mean you're always. Is it just the opposite? See? Okay, so there you go. But we don't always have to have a lumbar curve. You could have just one curve. I have only one curve. You could have three curves. You could have two curves. But did you realize that they rotated on each other? Okay. So that's why the padding in the brace is interesting, because it's not just pushing your curve inward side to side, but it's doing some three-dimensional pressure to de-rotate you too.
That's why we have the.
And that's why you have, yes.
So,
Why these things?
do we need to make holes in our braces like you did in that one, or is that just so that your body can breathe?
It depends on the curve pattern, yes, but usually there's either going to be a hole or there's going to be sort of a bubbly area that's not pressing on you as much.
Okay.
There's going to be a hollowed out area. Your brace is totally different because she's got a kyphosis as well, so it's giving her these cow horns to hold her back like this. But a lot of them will have the axillary thing, just this one,
I have this.
because in order for us to push this curve in, we can't just push it into a wall. We have to lift this up to make space to push it over. I'm no bracing expert. I would ask Dr. Richey.
That's very true.
I shouldn't speak on it. But yeah, the shoulders will rotate as well. And a lot of times we'll need like another, a lot of the times in the Scoli brace, they will put something to hold the shoulder in check too. So they will do rotations. And the fun thing is that they're always opposite of each other.
Yeah.
Okay? Any questions on that?
The,
Who knew?
the pelvis can be a big part of the correction. In
Big
brace.
time.
The what?
The pelvis.
Pelvic
and
Yes.
hips.
I just got my brace and I noticed that I tend to, because my right shift, you talked about shift.
So your curve is in your lower right.
Right.
Okay.
My hip shifts this way. So what the brace is doing
Mm-hmm.
is now adjusting my pelvis to the left. But
Yep.
the biggest change I feel is that because I am rotating, like you said, it's three-dimensional,
mm-hmm.
it's not just shifting me to the left, it's also pulling me back with my right hip.
That's why they did so much fancy scanning and
so that three-dimensional component of scoliosis, I think, is what people just see their X-ray and they see this.
sure, because
this,
an
and
X-ray
they don't realize.
is just basically a shadow on a wall.
Right. And they don't really realize that that is a twist.
Right.
And then what happens is that twist gets worse. Is you actually collapse.
And it can also get better. So the way that we evaluate that twist, because like if you're looking at this cartoon of the measuring of the X-ray, which, like she said, is just a shadow on a wall, basically. It's just they're just projecting through you onto a plate on the wall. So it's a one-dimensional version of your curve, but it's not assessing like, what do I look like from the side? Am I really curvy? Do I have a kyphosis? What's going on with my neck? Like she's done huge improvements on hers, so yay.
I was my X-rays kind of got here early.
And in the rotations, you have to measure those separately. So in this X-ray, we have the side-to-side curves that we can measure, and you guys probably all know what your numbers are, whatever they are. But then when you go to lean over, and you'll see those high sides and low sides, those are the rotations that you can measure, and they will have their own number. So you could have like a 60-degree thoracic curve, but it's only rotated 10 degrees. And then your lumbar curve could be rotated 20 degrees. So you want to know what the rotations are because it's easy to see these change over time when you're bracing and exercising. And because you're not going to do an X-ray every 5 minutes, you know, you want to do an X-ray every few months, but you can do this really often. And you can see the rotations. Can I borrow you?
No.
Or are you wearing your brace?
You can use me.
Come on down.
I have that exact curve.
Oh, do you?
Yeah.
Wow, that's fascinating.
I'll show
You
you.
look so straight.
Oh gosh.
He does.
So he knows how to do this. So come up for a sec. I'm going to turn you this way. All right, so I'm going to have his feet a little bit apart so that he's nice and stable because I don't want any sailors, right? So it'll keep him stable. So then the hands are together so we don't get any weird weird information like this. And then you will dive on down and relax there like you're stretching your hamstrings. Let your head drop. So this is basically just like a level, right? So you'll just put this on the back. And I always like to have like a nice low kind of airplane view of what's happening. Usually I'm sitting down and you'll just slowly measure. And sometimes I'll put like a little sticker so Brennan can see like this is 4 degrees and then we're gonna hit 0. And then at the top we're gonna hit 14 degrees, 15 degrees. And then we're gonna keep going. He might have another curve at the top. You never know, it can happen. And so we want to know what his rotations are. Like if do you have a brace? After he does CBP or gets an adjustment or does a workout or something, we might be able to see in real time that the measurements can change. So he has very low rotation here and higher rotation here. So he has a left lumbar and a right long thoracic.
Do mine like that.
If I had one of those, I'd have my husband doing that every night for me, so I could just.
That's
see
the
it.
problem,
That's
right?
Why I will
How
not
do you
do
do it
anyone.
yourself though?
You can't do it yourself.
Very nuts.
You can't do it yourself.
Yeah.
So you have to use 2 hands because you can't.
27.
It's called a scoliometer.
You're doing good.
Oh,
And
well,
you
I
caught
didn't know
it.
You don't want to use, like they make a cell phone app that will do the same thing. The problem is the cell phone app doesn't have this little cutout thing on it. So if you're using a cell phone, it's just going to teeter-totter on your person's spine and you're not going to get a good measurement. It's okay if, you know, it's interesting. The problem with doing it every day, like weighing yourself every day, you're going to make yourself cuckoo.
So that measurement actually represents the degree of
Rotation, yes. So if we have a curvature in your back, like I'm going to do yours. So she says she goes the other way. I like the spine. He holds his shape. Okay, so if we have a curve that goes like this, and we're going to measure whatever that curve X-ray angle is, or this one, okay, fine. But this curve here is going to rotate, and then this lumbar curve is going to rotate the other way, just like this did here. So what you'll end up with when you lean over is a bumpier high side because of the rotation, okay?
It's all making sense.
I love that.
Now.
I love that.
It really is.
I do have a question
Yes.
on the spine. How on earth do you get the C and the S? How is that even possible?
So I think what you mean is there's a side-to-side curve,
Yes. It's
and then
very
there's
prominent,
also a front-to-back curve.
which is very prominent. Yes.
Yes.
I mean, it's changed. We were, just grateful to be holding it still.
Yeah.
But it has changed very
Yeah.
many degrees since I.
So some people can have just the kyphosis curve, which is like this C curve front to back,
Yeah.
and no scoliosis at all.
They don't even know they have it. Yeah, I see it in people sometimes.
Yeah. Or they can have a scoliosis and no
Just
no
don't
problem with the
understand.
front to back curve. Sometimes they just
can
happen
you-
to all go together.
It doesn't make sense. To me.
Some people have the opposite thing. They'll have a scoliosis curve that goes side to side, and then the upper back will actually completely flatten out or even cave in to the opposite of what you're talking about. So they'll end up with a really, really flat back, which is the opposite of what you're asking about, right? Which is the really rounded back.
Yes.
Yes.
I have a huge hump in my back.
All right, so what we did is that we learned that in scoliosis we can have all those rotations and that they go opposite of each other, right? And then what we didn't talk, well, we talked about it a little bit, the sagittal curves, that is the front to back curve. So that's like, do I have too much curve in my low back? Is it flat? Is it reversed? Or is my upper back really rounded? Or like I was telling you, it can be really, really flat or even caved in.
Is that like sway back?
Sway back is kind of this.
Oh, is it? Oh,
Yep. But people call this a sway back,
Like
that's,
that.
yeah, I've read
right?
that.
So people will call it
Yeah.
whatever crazy term. But if we look at the spine from the side, we normally have just like this normal inward low back curve, and then we have a normal outward upper back, and then we want the neck to go in again. So if you guys have all seen your x-rays with Dr. Richey, you'll see that there's the green line and then there's the red line, and we're trying to get you to that green line to come to this beautiful position. Why? Because this is like a big spring. This is like a shock absorber. And we want these curves to be happy and healthy, so they're absorbing the shock as you walk around life, so that your scoliosis isn't trying to be the shock absorber. That's not a good day.
I
Okay?
find myself holding my breath. I feel like I hold my
Yes.
breath all day long.
Breathe! Breathe away from those curves.
Why do you hold your breath?
Just to get through
I do
whatever
too.
I'm doing.
Because
With my
you're-
brace on and
because you're in
everything.
pain, you mean?
Yeah.
Oh.
Try to. Does your brace have holes in it?
Does my what?
Does
Yeah.
your brace have holes? Okay. So you're going to start
I'm gonna breathe
breathing
in.
into those holes and expand. Let's do.
I've
Let's
always
just.
been this-
Let's do it right now. Let's do it right now.
By the way, I just want to give Dr. Richey a shout out. That
Yes.
He got my green and red line.
On the
100%
nose. On the nose.
No way.
Yeah, the last X-ray we did.
That's
Right?
Right.
amazing.
Yeah.
I told her I've never seen that happen.
Yeah.
Wow, that's
It's a lot of hard work.
3
I've
years.
been, it's been what, a little over 2 years now, Dr. Richey?
Yeah.
Yeah. Are we
And-
going
and
on
were you
3?
bad or just kind of bad? She must have been that bad.
What? Sorry, what
Were
was
you
that?
bad? Like really?
I had a near 80-degree curve in my,
What?
I don't know. I don't know.
yeah.
that.
What are we at now, like low 70s?
Yeah, I don't remember.
Yeah.
She's talking the side to side
Yeah.
Oh, yeah.
versus the front to back. On
Yeah.
her front to back curves, she got on the line.
Yeah.
That's
The green
Wow,
line.
fantastic.
It is a
How
fantastic.
many hours a day do you wear your brace?
Well, I was wearing it to sleep mostly, and then into the morning, sometimes in the afternoon.
To
But
sleep, really?
That
yeah,
would be
but
the best
it gets to a
time.
point where you're so comfortable in it, you
See?
feel secure, right?
Yeah.
That's why I love wearing
Maybe
my
I'll just try.
But
Yeah.
like I said, we just added padding, so it's like she called it brace tightening, like
Okay,
getting your
so I
braces
have my-
tightened.
Like when you got your braces and your teeth tightened, you were
That's
like, for a
exactly-
couple days, you were kind of miserable.
so
and then
I'm-
you're like, oh, I'm used to it.
That's exactly.
I'm readjusting.
So do we get what sagittal curves are? Sagittal is meaning what you look like from the side, like the number, the green line that we were talking about. Yeah. Okay. So next is maybe not as fun of a conversation, but when your doctor is trying to figure out what kind of curve you have, they want to figure out, are you structural or non-structural? What is the shape of your curve? Where is your curve located? Is it high, low? Is it in your low back only, upper back only? What direction did it go? Did it go right or left or right? The magnitude of the curve. So what is the Cobb angle? And you guys probably all know what your numbers are, which are the side-to-side curves that are measured on the x-ray. And then what are the effects in the sagittal curves? So Dr. Richey always takes a side view x-ray, and trust me, there are a lot of radiologists and orthopedists out there that never take this picture.
Why?
I don't know. It's very frustrating because it is such valuable information about your spine because you are not a one-dimensional creature. You need to know what these curves are doing. So we want to know what the effect is of those sagittal curves for sure. And then, as you now know, we want to see what the rotation is. Where is it? So you've got like a small lower with low rotation and then like a longer top. But maybe we would never have known that if we didn't take a peek. So you want to know what the rotation is and where, and I chart everything. And then we want to know if we can figure out what its cause is. Most of us walking around have idiopathic scoliosis, meaning we have no idea what caused it. They're trying to figure that out. Some people have a legit cause, like they have a condition or a syndrome or a disease or an injury or a fracture or something that caused it. But usually it's just like, we don't know. Is it genetic? Is it melatonin? Is
I
it,
think genetic
what
has
is it?
something to do with it.
So what is the difference
So-
between idiopathic and other forms of?
okay, so the other forms, let's back up. So the different types of scoliosis, we have non-structural and structural. Now those are two, like just take your brain that they're totally different continents, okay? So non-structural is something called functional. I hate when they give it multiple names that mean the same thing, but it does, which is something that is not in the spine. So that's somebody who has a curve that is not a true scoliosis, meaning if they bend over and we do that rotation test, we're not going to see any rotation. And if they lie down, the curve goes away. So maybe it's a curve because one leg is longer or shorter than the other, or they have a muscle spasm or something happened, but it's not a real scoliosis. It goes away the minute you go to look at it, kind of a thing. So that's a non-structural. A structural scoliosis means that there's something in the spine that's a bit baked in. The bones are a little bit different shape. Things have rotated. Things are physically different, and they are not going to fix themselves without outside intervention, which is CBP, chiropractic, Schroth, bracing, surgery. Like you have to do something to it. So when we were young and the doctors were like, well, we're just going to keep our eye on it
Yeah, thanks a lot.
and we're going to see what it does, which means we're going to wait for it to get worse
Yeah.
because they don't resolve themselves and they don't tend to, always hold still. They tend to migrate and get worse, especially when you're in the middle of a growth spurt. Now, we said a minute ago that it's hereditary, like there is a
I
genetic
think
component.
that is a big thing.
So as grown-ups with scoliosis, we have to kind of look down to our kids and our grandkids and our brothers and sisters, etc., to have them screened, because if it's in the family, we want to have the young ones checked so that we don't make the same mistake of waiting too long to address the situation. And the easiest way to screen a child is, guess what?
Have them bend over.
Exactly. So you can either see it with your eyes, or you can do the little scolio. You can get these on Amazon.
What's the
And
typical
you're not
age?
allowed to buy one.
The typical
You
age,
start to see it.
You can see it as early as, if it's like a
15,
congenital
16, right?
scoliosis, that's extreme. You'll see it as soon as they're moving about and crawling and standing. But if it's like an idiopathic that's sort of showing up, it can show up at 8, 9, 10. Usually it shows up at peak velocity, which is like, peak velocity is, what I mean by peak velocity is when they really start having a growth spurt, like 12 to,
I want to say that's about when my mom caught mine, because
Yeah.
she had it, her mom.
and that's why they used to do screening in junior high.
So it is familiar. Yeah.
They used to do something like this in junior high. They weren't using a device, but they screened us all,
Yes,
right?
I remember that.
And they were looking for something. What did they do with that information?
Nothing.
Not much.
When I'm like, I already know I have it. They're like, well, just do it. I'm like, okay. You know, I already knew at that point.
Right.
We were doing intervention at
Right.
that time.
Oh, we were talking about structural and non-structural. Okay, so with structural, we were saying that there is something technically different about the spine, and it's a true diagnosis once that curve that we talked about earlier, the side-to-side curve, if it's 10 degrees or more, and there is some rotation, you're like, that's a true scoliosis. 10 degrees or more with some rotation is a true scoliosis. So the spine structure is different, and like we said, it's not going to just change on its own without some outside intervention. And we already talked about the idiopathic type, which is one of the types in that structural, because structural, remember, it was this whole continent over here, and there are like a million things that can happen in the structural, and there weren't that many that could happen in the functional. But within the structural, we have a million different types. Most of us are having the idiopathic type. And then we were going to talk about conservative treatment a little bit, which you probably already all know about it. You're doing it and you're in it. And the goals of conservative treatment are to prevent curve progression. Maybe it's not going to get remarkably, amazingly better, but we don't want it to get any worse from where we are right now. If we get some improvement, yay, amazing, especially with children, and managing pain. For me, I did not care as long as I wasn't in pain every day, every minute that I was awake. It was horrifying, right? You guys know what I'm talking about. And then just improving overall quality of life without the risks associated with surgery. This approach is particularly effective when started early, so that's why we want to screen the kiddos and make sure that we're looking to catch it at that peak velocity or even sooner. And adolescents who are still growing. So conservative treatment is the proactive approach, beginning as close to the time of diagnosis as possible, typically when the condition is at its mildest, but we're going to work with what we have. And the most responsive to treatment, obviously, is younger. Treatment plans include custom bracing, specific exercises, and those exercises are highly individualized because everybody is different. All your braces are different, and address each patient's unique curve pattern and their growth stage to maximize effectiveness. Any questions on the conservative part of things? In adulthood, scoliosis can lead to muscle imbalances and chronic pain in adulthood. Conservative methods effectively address these issues through various interventions. So why more muscle imbalance and why more chronic pain? Well, it's kind of like a vicious cycle of asymmetrical load, right? So if we have this rotation and we have the bending, what's happening is this perpetual asymmetrical load that's happening. So part of that is if the hip is out all the time. Let's just make an example. Like, let's say I have a lumbar curve and my pelvis is really out of alignment. And you don't really notice the pelvis, you're focused on this curve. But if I don't get the pelvis in alignment, I'm creating like this crazy diagonal of asymmetrical load. And now if you drew a line down the middle of me, wouldn't I be kind of leaning off that line? So there's a lot of load where on this curve. And it hurts all the time.
Right there.
So we're having now this constant load on the curve, which is going to cause it to maybe spiral more, and these poor little discs and the poor little nerves. So the job is to get as much of the load more symmetrical as we can. So that would mean, okay, I got to get this bottom Lego in, and then the brace, and then your posture to bring this in. And we just want to get these blocks stacked better. Maybe it's not going to be perfect, but if the asymmetrical load could be a little bit better, your longevity of this system is much improved, right? So asymmetrical load is not our friend, and that's what's going to cause this cycle of I'm in pain, so I'm going to lean more. The pelvis is out. The curve is going to go more. More load, more curve progression, more pain. Blah, it just keeps going.
Less balance, everything.
Yes, yes, literal and figuratively, because the balance, I'm off balance, but also my actual balance might not be great because I'm not level anymore. So you're, balance in both directions.
Is a lot of the reason for the corrective exercise almost a neurological as well? Because if your body gets accustomed to being a certain way,
Sure.
that pattern exists in your brain.
There's an interesting exercise that Scoli Balance does that you brought up. If you're just sitting and you're not even standing yet, you're just sitting, and you learn how to do your correction, which will start with your pelvis, and then bringing your curve into some kind of alignment, and then maybe the next block, and you're just manually doing that with your own mind, and you're elongating, and you're doing all of the things, maybe you're even breathing, but you've just stacked your blocks the best you can, and you try to maintain that, and then you just start tossing a beanbag, or a ball, or whatever.
I like this idea.
Not that it's hard to do.
No, I'm like, this is good.
But your brain is like, oh my, we are holding a new pattern and trying to do it's like left brain, right brain, left brain, right brain. So you start doing this right brain, left brain thing, like tossing a beanbag or a ball, and your brain is learning, oh, this is center, right?
It's like you're training yourself.
Totally.
And that is so hard to do. I think that's
But-
why
but-
it's
but
when
it's-
we get older,
Yeah.
if we would have caught it at 15, 16.
Sure. The asymmetrical load is becoming a little bit more habitual. Your muscles are used to being a certain way, and your balance system is kind of like, because if you just take one of us that feels like we have a curve and we move them to what is straight, you're going to feel like, oh, that's not straight. That doesn't feel straight, because your brain is used to something different. So just retraining it to learn this is where center is can help you retrain so that you can automatically find that
I'm
center.
confused. I can't even feel it in my own body. It seems like maybe I just need to have a picture of it all the time. or something.
Sometimes I think the pictures are everything. I like to have a
I don't know
diagram.
which side's going which. I'm like,
I love to draw it. If you can't, because some people don't want to look at their x-rays. They're like, I don't want to look at that. Thank you very much. Like, let's just draw a cartoon. So if you have a picture, literally just a little simple. So if I do a simple drawing,
yeah.
and I'm looking at you from the back, because obviously that's your hair, and I will mark right and left, because sometimes when you're exercising or you're doing any of the things, and you start to rearrange yourself, you will forget, where's my curve again? Is it the top? Is it the bottom? Which way did it
It's
go?
like brain overload.
That's how I am right now. I don't
Right?
even know which way's up.
And then if I, this is looking at you from the back, but what if I flip you over and you're lying on your back, and now you're like, okay, which way did it go again?
Yeah.
I think having something really simple for yourself,
And how do you get that? By looking at your X-ray and then.
by looking at your x-ray and just draw
Yeah.
a cartoon.
It's a good idea.
I'm gonna do that. Really.
Right.
I've done that where I've actually drawn the spine, and then wherever I'm curving. I don't know if
So those
that's
are
right.
also your
So you can
rotations,
see-
right?
You can
Yep.
also understand your rotations,
Yes.
so that when you're de-rotating and elongating, you're coming out of those curves.
Or you could put your numbers on here. You can be like, okay, I know that this is a 65-degree curve, and it rotates 10 degrees, or however you want to do it.
Right.
But I do the cartoons every single day, because I see so many people that I have to be like, what was your curve again? Let's get your cartoon. So that when I have you exercising, I'm like, all right, you're on your left side. What's happening now?
It's hard to move the top part. Didn't you find this when you're trying to do this? It's hard to move the top section.
It's very hard to isolate these from each other, because they are doing separate things from each other, and we're expecting you to isolate, put this shoulder back, breathe on the left, breathe on the right. It's mind-blowing, but you get better at it. You get better at it. So having the little cartoons helps, because I might say, okay, well, what's going to happen when you go home and you sleep on your right side?
Oh my God.
Is that the best side for you? I don't know. Maybe you're better on your left side because of your curve. So you just have to kind of think about what your curve is doing in all the ways that your spine lives.
Right, but if you're wearing a brace, you have to be on your back. don't you?
Usually,
How
yes.
could you sleep any other
I
way?
can't sleep
I
in
had
my
one
brace
side
on my
I could
side.
sleep
I
on.
have to.
Most people sleep on their back.
But I feel like it's not a good thing to do.
Yeah, but if you have your brace off and you're working out or
Yeah.
doing something else
I
like
sat
that.
there, and then at some point, I get like a pillow.
You would?
I know it's the wrong side.
Oh.
Yeah.
But it's comfortable, and that's how you can sleep. You have to get sleep.
And being on your back is better anyways, because gravity is just very symmetrical on you. Because on your side, you're never going to have a really perfect world no matter which way you go, right? If you have more than one curve. So on your back, even if you didn't have a brace, is just better for your spine. Any more spine questions? Everybody is unique. But the research shows that exercise with bracing is the best combination. And they used to say, like, don't do this exercise, don't ride the horse, don't do gymnastics, don't play tennis, like all these,
Rotational.
or just don't work out, don't do yoga, don't do Pilates, because they were just worried that you were going to hurt yourself or it was going to be a goofy.
Pilates as a trainer for 20 years.
Sure, but now they've
It saved
discovered
me, but then at a certain point, you know, that curve is still
it's
increasing.
absolutely. So they have discovered over, like I said, research is getting better and better and better, more prolific, that any exercise is beneficial to scoliosis as long as it's not super high impact. That anything that's keeping you conditioned and limber and strong in your core is going to help your spine. Doesn't matter what it is. It's all good. Don't stop moving.
And do you offer, for example, if I'm getting treatment here with a Scoli brace, and there is a Scoli brace programming exercise,
It's called Scoli Balance.
Scoli Balance. You do that training
Yes.
in your studio?
Yes.
In
So when I got certified in the Schroth method, there was then another different method that's a different program completely called PSSE. That's in Greece. So I did that program, and it was very different than Schroth.
Right.
And then I did BSPTS, which is kind of like more the Spanish, Spain.
Oh, you did both.
The Australian program, which is the Scoli Balance program.
Okay.
And they all have something very interesting to say and different nuggets to take away. But at the end of the day, it was all coming to the same basics. And it would be hard to distill it down to you what the basics are, but I'll try. Elongation, whether it's self-elongation, because if you just sit here now and just try to pull yourself up as tall as you can, from your hips up, it's hard work. But it's good, it's decompressing your spine. So there's self-elongation, and then there's actual traction, which was everything we were talking about with the stall
Love
bars,
that.
right?
This machine, I want one.
Right? just to be pulled apart just feels amazing.
Wonderful.
Whether you're
No,
hanging,
I'm a sick person.
but
do
it's
that.
got to be like activated.
Every
You
day.
can't just passively hang all the time. You have to activate. So elongation will
As soon as he pulls me up on that, I'm like, oh.
leave me here all day, right? So elongation, the breathing away from the curves is a really big thing. So that's asymmetrical breathing. How do I do that? It's not that hard. You just have to get a little bit of instruction, and then you can master it. And it's, for me, it takes my pain
Down, levels down.
crazy. So breathing is a big part of it. So all these programs teach this like three-dimensional asymmetrical breathing, and they're always compatible with the brace. So we have elongation, three-dimensional breathing, and then stabilization is a big one. Just
So
learning how to be,
derotation is stabilization?
well, the
or
breathing actually becomes the three-dimensional derotation.
derotation? Okay.
Because if you have a brace, like, and I'm gonna breathe only here, and the breathing is sort of out and back and away. When I breathe out and back and away, that creates derotation.
So you're saying like breathe and like lean into.
'Cause you're
You're not physically leaning. You're expanding.
Do you want to show
On your brace? Yeah. Just
Yeah,
leave it on and
I'm
Because
visualizing
your
this
diaphragm is
concept.
a muscle that's actually helping.
say again.
your diaphragm that
Yes.
you're using to breathe
Yes.
is actually creating the space for that rotation.
Not
to-
just your diaphragm. You can actually breathe into a spot.
Okay.
So for her brace, can I pull her up?
Yeah. Okay.
Okay, so turn around for us and just be this way.
Okay.
All right, so she has this nice big hole space here. She has a lot of pressure over here with padding and the brace.
Yeah.
So this is pushing her curve this way.
That way,
So
yes.
she has a curve that goes to the right, whether it's thoracic or thoracolumbar, whatever it is. This hole is giving her muscles room to do their thing, be alive, stay with us.
Wake up.
They're
Wake
having a
up.
party.
But I can put my hand in here and I can say, you know what? There's a bubble in here. There's space in here. Can you breathe and fill my hand into the plastic? More.
More?
Big.
Yeah.
Okay, hold on.
And it will take some practice, but she can tell herself to breathe in this location. That's not even her diaphragm. Her diaphragm is like,
Okay.
right?
True.
Okay.
So she can learn
Oh, I
to
can
breathe
feel
here.
that, yeah.
If she can be specific enough and practice enough, she's actually breathing this way, right? She's breathing sort of backwards and outwards. And when you breathe backwards and outwards, it's going to pull the ribs as a lever to rotate that way.
I see.
So it's creating like an internal
Makes sense.
correction of your curve. The brace is doing external. I love to think about it like this, like your brace is externally pushing the curve, but your breathing is the internal force. Think about a dented soda can
Aren't you proud of me?
that you could blow air into a soda can that was dented and you could pop the dent out. Think about it like that, like the breath could pop this out if she can breathe and expand into it.
Am I doing the right thing then?
You're getting better as you go.
Well, I'm gonna be very mindful when I put my brace on.
Right?
When I get home.
Getting a little lightheaded, but that's okay.
Yeah, just go slow. Big, slow inhale. And then actually, as you exhale, try not to just go.
Yeah.
Think about the inhale when you made all the space. Now keep that space as you So you're sort of keeping that. I want you to think about a little umbrella that's opening in here.
hard.
Open it up.
It's hard.
Keep it open.
Now keep the umbrella open as you Yeah, you did.
Whoa.
And Scoli Balance talks about it as
That
an
was
umbrella.
Cool.
So you can really get good at this. You could learn to fill this entire hole up. Oh yes. And is she breathing everywhere? Of course she is. But she's directing her breath to this spot, right? And you don't have another bubble anywhere. She one curve?
But- No, I haven't. Don't I have?
Yeah, it's
It's good.
a little bit lower on the left.
Wait, I gotta pull this tighter. Hold on.
So you have a little bit of a bubble over here.
It's much better. when It's tighter too.
You couldn't even tell you had yours on. I'm like this. I feel like.
So you could do the same thing, even without a brace. He's got like a long thoracic, just breathing on the left and shifting over there a little bit when you're not wearing a brace. You can fill that space up.
I do these exercises at home where I put a half roller under my right side, and I lay here and I
Just expand it open so that you're having the external force pushing the curve and then your internal force doing even more. So it's quite three-dimensional, internal and external. So the breathing becomes a rotational force.
Somewhat, but that's more.
It's because your ribs are like bucket handles. So if you open ribs on one side, you can see that it would cause some turning.
Next level.
So is that included in the Scoli program that you?
Oh yeah, all the programs are heavy on the breathing. Yeah, Scoli Balance and
You can help the person understand with their brace on
yeah,
how the best way.
yeah, like for her, right?
Yeah, that was huge.
Like I don't even know her curve pattern, and
Yeah.
I know what the hole is for. I know what her brace is doing, and that's
Okay.
gonna benefit her.
He says tight enough that you can still breathe.
Yeah,
I can still breathe, but it's tight.
but now you know where to breathe.
Yes.
Yes.
Thank
You're welcome.
That's so cool.
Congrats.
Amazing.
Yeah, absolutely.
Amazing.
Oh, I'm so glad we all got something fun out of this today, and I'm glad you guys all came along for the ride. And I'm happy to answer any questions anytime. You can find me